thanks for coming early, Dave.
Yeah.
It was a good opportunity on the we're having a strategic planning for the college here at the lovely Richmond Olympic Oval. I'm distracted by ice skaters in the background. And thank you very much for coming early to have a chat with me about the quality assurance program.
Yeah, you're very welcome. Yeah, I'm glad to be here.
So Dave,
Yes.
you're the current chair of the Quality Assurance Committee. Why did you decide to get involved with the committee?
Well, I got involved in the committee in, I think, 2013. And before that, I was quite involved with the annual self-report, which was a subcommittee to the Quality Assurance Committee. And so that just seemed to be a natural progression to stay involved with the quality assurance program or part of the college.
Does quality assurance as a program or as an activity of the college, does that speak to you in particular?
Yeah, I had one of my jobs as a physiotherapist was basically helping physios to ensure, I guess, competence to practice in their workplace. I found myself trying to figure out what the difference between competence and confidence was.
Competence and competence. Oh, okay. Okay.
Yeah, and so that led me to, I guess, get involved in developing some type of tool to look at that, and then that, I guess, led me into getting involved more in quality at the college level. So it was involved with quality type of work in my workplace, and then it just seemed to be a good fit to get involved with the college.
When you think about the purpose of the whole quality assurance program, and if you needed to describe that to the average physio registrant, what would you tell them?
So we had a good long look at that in the early days of developing the quality assurance program, and I think the first thing is public safety, and I also think of ensuring best practice. I think of ensuring ethical practice, and so basically the overarching goal of the quality assurance program is to ensure safe, ethical, and effective physical therapy services to the public.
Okay, so then so that's the whole program. How does the RCA part of it contribute to that?
So the Registrant Competence Assessment is designed as a screening tool, and the ASR really is an opportunity to have people engaged in some of the jurisprudence parts of being a physical therapist. The RCA was designed to give an opportunity for physical therapists to demonstrate competence through writing an exam that was based on clinical questions that have been developed by frontline physiotherapists from around British Columbia. And the belief is that by writing that exam, that it is a demonstration of your knowledge, and it's also, the way the exam is written, it's also a demonstration of your practice knowledge. And so I think it's worked as a good way to screen and identify physios that might be struggling in their practice.
And what happens if we identify people who are struggling through the RCA? Then what happens after that? How does that help ensure public safety?
So I think it has the opportunity to identify physios that might be struggling. There's also just a recognition that the exam process and whatnot can be difficult within itself, and so there is another opportunity to write the exam. But if ultimately the registrant's not able to pass that exam, it moves them into another stage of assessment, which is a more one-on-one assessment of their actual clinical practice.
Okay.
So not unlike being in a workplace, and you want to ensure that your staff are competent in their work, And so people are involved in performance management, and part of that is assessing their practice, and sometimes it's doing site visits or chart audits, or there's a variety of different ways that you can assess somebody's competence. So the RCA acts as a screening tool to help identify some of those registrants that may need a more one-on-one assessment of their practice. Again, it feeds into the belief that as registered physical therapists, we are competent. So in terms of the public, how do we demonstrate that to the public? And so in passing the RCA is a form of demonstration. In going through an assessment process with an assessor, it's another form of demonstrating. And then if somebody needs to do some work on their practice for further demonstration, it gives more opportunity for that.
Because we do hear the criticism that if our assumption is that the majority of physios are competent or meeting a minimum standard, why do we go to the expense and the effort of having everybody write the exam?
We have public members on our quality assurance committee. So a lot of our decisions around the quality assurance program are include members of the public. And so we put those kind of questions to the committee. And the public members really value the work that we're doing and the fact that we're including all physiotherapists and that every physiotherapist has to go through this process as a way to demonstrate. And so I think that was a big reason why it had to do with our engagement with the public and having their voice as to what would be a meaningful way to demonstrate competence. I think there's a high level of efficiency as well with doing it this way, because no physiotherapist is excluded from the process. So I think it also that actually I see that as strengthening our profession.
So if we look at the exam specifically then as a choice of method for demonstrating competence, we do also get criticism from physios who say, well, why wouldn't we choose something that's more about learning, something like continuing education credits? What do you say to that idea?
As far as continuing education credits, I've been a physiotherapist for 20 years. My personal experience with courses is, unless there's an exam attached to the course, attending a course doesn't produce the outcome that you actually learned anything, that it's going to change your practice or it's going to improve your practice. It may, but attending a course doesn't ensure that you're actually going to be a better physiotherapist as a result. It may, but my experience is it doesn't often have a big impact. So then there's other logistics like cost.
Yeah.
The cost of continuing education is significant to take a course. Then there are access to continuing education, and to some of the courses you have to travel. And so when you think of the registrants that are dispersed through the entire province, when you think about how we need to have physiotherapists serving in rural practice areas, and if we create barriers to their being able to be registered physiotherapists, I see that as being a problem as well.
So a bit of a fairness issue.
Yeah, the
access.
Yeah, so I mean, fortunately, because of technology, you can access the RCA from anywhere in the world, literally. So that, I think, that seemed to make a lot of sense as well.
Right. Okay. When you think about the RCA then going forward, so we're coming into the second administration of it. If you think about the next steps as chair of the committee,
yes.
What are your priorities?
I think the priorities would be around fairness in the process for the registrants. I think as a committee member, we have active registrants that sit around the table We have public members that sit around the table. As the chair, I want to ensure that people have a voice around that table that speak to some of the concerns that may come from the registrant's perspective, that comes from the public's perspective. I would like to move forward and support this as being an evidence-based program, and so.
Evidence-based in its design, it's in its evolution, or in how it's used?
Yeah, so going back to the continuing education credits, there is not a lot of evidence that results in competence. So, so that was another deciding factor around not using just continuing education credits. The other thing, just to back up on that question a little bit, when it comes that this exam process or the quality assurance program, the RCA, certainly doesn't keep people from doing exams. It doesn't
doing courses
and reading and things like that. So I think that is just, I strongly encourage physios to continue to learn and to take courses and to read and to stay up on the latest evidence in terms of supporting their practice.
Right.
But that's not what the quality assurance program is designed for. It's not an education program. It's
the RCA isn't an education
the RCA.
program. Other aspects of it can be.
Well, it can be, but the overarching part, going back to ensuring the public safety and ethical and safe practice, effective practice. So.
Do you coming back onto the evidence-based, you wanting the RCA to be an evidence-based tool, do you plan an evaluation of that component of the quality assurance program to see if it is doing what it's meant to do?
There isn't a plan to do an evaluation. We've gone through one cycle. We'll be going through 2 cycles, and that's going to produce quite a lot of data that can be looked at and evaluated. And my experience so far in being a part of the quality assurance program and the chair is that we do take a good hard look at these things, and if there are adjustments that need to be made because the evidence suggests that, then we do make changes to the program.
Okay. Do you have any other thoughts on how the Quality Assurance Committee can address other concerns that registrants have regarding the exam itself, or anything else about the Quality Assurance program?
Well, there's a couple of things that come to my mind. One is the opportunity for registrants to be involved.
So, we need writers.
Yeah, there's writers. All of the exams the questions, they are all written by frontline registered physical therapists around British Columbia, with a level of expectation that their colleagues would know this information. Yeah. There's also an understanding that we don't need to know, or we were not expected to know everything about everything in physical therapy practice, which is why we've given opportunities to write exams in different practice areas. But as far as registrants, they have the opportunity to be involved directly, whether it be volunteering with the Quality Assurance Committee or being an item writer. So as far as other concerns, we do hear those concerns. I mean, the town hall meetings that you and Diane have been doing, the feedback that we get from AGM, we actually collect that information and we bring it to the Quality Assurance Committee. Again, the Quality Assurance Committee is made up of people who are active registrants in British Columbia who have the same concerns as anybody else coming to the table with concerns. And so we take those things very seriously and address them as they come up.
My final question, and it does relate to a concern that I hear, I've heard in 2015 and I've heard it a couple of times this year, is around the idea that experienced physios are planning to retire rather than write the exam. What would you say to people who are contemplating that?
Well, if you're contemplating retirement, I think that's entirely separate from writing the exam. One of the reasons why is the consequence. So if you write the exam and you don't pass the exam, it has no consequence in terms of losing your registration.
Right.
It can act as a means for identifying learning needs. So if you're unable to pass the exam, it has the opportunity to strengthen a person's practice moving forward, whether they're at retirement age or not.
Yes.
But there are certain risks. I think the literature is well established in that area, that people that are closer to retirement are at higher risk for having competence challenges, and that's not with physical therapists. That's with physicians, and so So I see that more as an opportunity. If you have concerns about your practice, you're not avoiding an exam out of fear that it may expose some areas that you're not competent in. It's an exam that you can write that may put you down a path of learning, developing, and again, I don't see that really to be related with retirement.
Thank you very much. That was a great answer.
Yeah. Off too.
I really like your answer to that last question.
Good.
Really like that. I hadn't thought of it from that standpoint. I usually just say, well, I'd be disappointed if that's what people are thinking, but it's a nice way to reframe their thinking, actually. That don't look at it as a threat or a risk, look at it as an opportunity to learn more. And if that's where you're coming from in your practice, and that's where you've come from in your practice your whole career, this is just another way to improve what you do.
Yeah.
That's really nice.
Yeah. And that's the part where I believe that stuff.
So do I. But I hadn't really thought of it in those words.
Yeah.
I always looked at exams in school. I always looked at exams as a bit of an adventure, and it I think that mainly came out of anatomy. With Dr. Frizz, it was always going to be interesting or exciting what he presented to us in that exam, and it just helped not to get stressed about it. It was going to be yet another learning opportunity. Where is he going to stick that little pin?
And as you know, my background with the ASR.
Yeah.
It's about engagement. So I think the ASR has been a really effective way at engaging registrants in materials that otherwise would not be looked at.
Right.
I think a lot of us, not just physios, but just humans in general, want to do well. And so when you do the annual self-report, and if you don't know the answer, that leads you to finding out what is the answer.
Yes.
And so while an exam like the RCA is not entirely designed like that, ultimately the outcome is, if you're not successful, does put you down a path that's more focused learning to demonstrate that you know your stuff.
Yes.
And that you're not a risk to the public, and because that's really what it is all about. I mean, this is all about public safety.